Hello, Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm here today with Dr. Katrina Mitchell, and we will be chatting about her upcoming presentation. Welcome, Dr. Katrina Mitchell.
Hi.
It's so good to have you here. It is wonderful to speak about the Lactation Online Conference 2019 that's coming up just around the corner, right? And here at Gold, what we do is we talk to our speakers a little bit so you, our listeners, get to know them a little and hopefully will then come to the presentation and learn what there is about the topic of breastfeeding complications that will be presented here by Dr. Mitchell. So before we go into the presentation itself, can you tell our listeners a little bit of where you are in the world?
Sure. Right now I live in the Southwest United States in the state of New Mexico. So I live near Colorado and Arizona, Utah. We live at 5,000 feet of elevation, so we have a lot of sun. We have snow in the winter, and it's generally beautiful weather.
Mm. It is beautiful. I've been to New Mexico. I must say the colors are just amazing. And you see it there on your picture that you have there in the background. You have these beautiful deep blue skies and the adobe colored houses and backgrounds. It's just beautiful.
The cover picture for this lecture is in Belize,
Oh,
where but we do have bright blue skies here, which is one of the reasons why I live here. But I like to go vacation where there's bright blue skies too. So
oh, wonderful. That's great. That's wonderful. Do you have any snow right now?
we do in the mountains that are about 20 minutes
Mm.
west of us. So I live in
Right.
the main city of Albuquerque, but we have mountains nearby, and then the Santa Fe ski area is about an hour north of us. So we have tons and tons of snow this year.
Oh, wonderful. Good. Okay, now moving on to you. We, of course, want to know all there is to know about Dr. Katrina Mitchell. So tell us a little bit about your background and what you're up to nowadays.
So I am a born and raised native California, and I come from a family of breastfed kids. So I did general surgery residency and medical school on the East Coast and have gradually made my way back to the West Coast. I did my breast surgical oncology fellowship at MD Anderson in Houston, Texas. Um, and then I came to work at this MD Anderson affiliate program in New Mexico. So the primary scope of my practice is the operative care of women with breast cancer and other benign breast disease, but I also have a particular interest in caring for breastfeeding dyads.
So tell me a bit about that. So you're a breast surgeon. How did that develop that you said, oh, I need to be a birth certified lactation consultant. This fits right in. How did that develop? Tell us a little bit about it.
Um, well, I think I loved breastfeeding my son. Well, he's still breastfeeding and is 3.5 years old. So
Wonderful.
I had a challenge of my own around probably 4 or 5 months postpartum and got connected with an OBGYN who was part of the Academy of Breastfeeding Medicine in Houston, where I was living at the time. So she told me more about the ABM and I got more involved. And then when I started my practice, I um, just, I don't know, at that point I had cared for a lot of breastfeeding complications in
Mhm.
general surgery residency when I lived in Africa, working for Cornell. And I just was something I really enjoyed, and I thought it was kind of a nice complement to taking care of cancer patients. So um,
Mhm.
just I went down the road, and I thought that doing a lactation consultant degree would also just help me learn more about parts of the baby side and the birthing side that I don't necessarily, I'm not that necessarily familiar with after years
Mhm.
of doing surgery. So,
Right. So it is, it's a wonderful combination that you have there. And congratulations on breastfeeding your son that long. That's wonderful. Huh. Now, let me ask you this. Do you see a lot of, are we, about your presentation, you're going to talk about breastfeeding complications and you're a surgeon. Do you see a lot of women with breast cancer who are, just had a baby or maybe pregnant? Do you get to see that too?
yeah, I mean, that's definitely part of my clinical interest because I do care for these women in general, and I interface with the OBGYNs with obviously a lot of the breastfeeding patients. So if they have a new mass,
Mhm.
then that's where they go down the route of seeing me anyway. So I probably see higher than the average breast surgeon of these postpartum and pregnancy associated breast cancers. But fortunately, in all
Mhm.
comers, there's still a very low percentage of all comer breast cancer patients are probably about 1% of the breast cancer population, which is a good thing. But when they are diagnosed, they tend to be more aggressive cancers, and so
Mhm. Mhm.
it's important to kind of manage the lactation component of it and
Right.
the cancer treatment.
Right. Is it a myth or is it really true that during pregnancy the cancer grows faster or can grow faster?
I think that's probably when we look at the data now, we used to say that pregnancy cancers that occurred during pregnancy had um, worse outcomes than if you were not pregnant. And when you tease out the data between tumors that actually develop during pregnancy and those that develop in the postpartum period after you've delivered the baby, the postpartum cancers are the ones that are more virulent. So
Mm.
in terms of the diagnosis and the delay to diagnosis in pregnancy, we've done better with that at this point. So stage for stage, the pregnancy associated cancers are similar outcomes to those when you aren't pregnant.
Mm. Well, thank you for sharing that. That's interesting. Now to your presentation, you will be talking about breastfeeding complications, and I absolutely love that sign that you have there, speed bumps. That's a perfect sign for the presentation. So tell us a little bit about it. What will you be presenting on?
So I'm just going to talk about challenging maternal complications of breastfeeding because obviously I guess this we should think about complications of when a baby is failing to thrive, but that's sort of a completely different topic. So I'm going to focus on things that happen to mom that are often managed by surgeons such as abscesses and galactoseals, but also cover some other important topics like dermatitis and the fact that there's no evidence to support the diagnosis of yeast or intraductal yeast in
Mm.
breastfeeding moms, which is something that it'd be nice to sort of change the common thought on that because there really is no scientific data to support that diagnosis.
That is absolutely interesting, and I'm looking forward to this presentation because even in our training, me as a midwife, we are often taught look out for yeast infections, and so I'm very much looking forward to learning about that, what you just mentioned there.
Yeah, I'm not sure where that started, but there's some good scientific evidence talking about subacute mastitis and
Mhm.
other diagnoses that may, particularly dermatitis, that I think may be called yeast but are not
Mhm.
yeast.
But
So
are not
as a
yeast.
breast surgeon, when I started to interface with the breastfeeding world, I said, why is everyone calling this stuff yeast? It's,
Yeah.
yeah.
So that is wonderful that you will be educating us on that because I think that is a misconception then that I was not aware of either. So that's fantastic, wonderful. So before I let you go, what are you hoping that our delegates will take away from this presentation?
I think I'd like people to take away when knowing when they should refer a patient for a
Mm,
workup of a persistent mass and just have an overview of the radiology studies that the physicians may order if we have a physician crowd or an IBCLC crowd. I just would like
yes.
everyone to kind of be generally familiar with that. That will kind of close out the presentation, but at the beginning it's more just being familiar with the things, the more complicated maternal complications that may come to a breast surgeon. And like I said, the other diagnoses that I'd like to spend some particular time looking at the nipple areolar complex and in particular dermatitis that I think a lot of people are diagnosing as yeast. It's not yeast.
Mhm. Wonderful. Well, thank you so much for sitting down here with me, Dr. Katrina Mitchell. It was absolutely a pleasure talking to you.
Sure, you too.
So Dr. Mitchell's presentation on breastfeeding complication is part of our Gold Lactation Online Conference 2019. And Dr. Mitchell's presentation will be live on April 15th, but check your website to make sure to find out when it is in your time zone. If you're living in Australia, it might be on a different day on the next day. So please visit goldlactation.com for the times of this presentation and also on information on the other presentations that are part of the Gold Lactation Online Conference of 2019. And thank you one more time, Dr. Mitchell, for spending time with me here today. And thank you to all our listeners. Bye-bye for now.